Cactus 1549, no departure to contact line, maintain 15,000.
Day 15,000, Cactus 1549.
After a series of avoidable crashes in the 1970s and 80s, commercial airlines finally got serious about passenger safety.
49, turn left lane 270.
This is Cactus 1539.
The airline industry developed a revolutionary new system of job training and information sharing called crew resource management. Pilots, flight attendants, and ground crews were all trained to share information and better collaborate on the job to dramatically reduce the risk of human error and radically increase the level of safety in this high-risk industry.
Can't do it.
Okay, which runway would you like at Teterboro?
We're going to be in the Hudson.
I'm sorry, say again, Cactus?
210, 4718. I don't know, I think he said he was going in the Hudson.
Lives were saved due to the combination of a very experienced, well-trained crew, all of whom acted in a remarkable display of teamwork, along with expert air traffic controllers, the orderly cooperation of our cool-headed passengers, and the quick and determined actions of the professional and volunteer first responders in New York City.
After 30 years of CRM training, air travel is now the safest it's ever been.
In the last 30 years, the airline accident rate has decreased at least tenfold.
How safe and reliable are other industries, like healthcare, where saving lives also requires teamwork and communication?
What occurred during my daughter's hospitalization in the pediatric intensive care unit was really a cascade of errors and miscommunication.
We harm millions of patients a year and probably kill 100,000 or so patients a year, maybe more than that, from medical mistakes.
So in many ways, we kind of continue blindly down this dark hallway or dark hole that set us up for both harm to my patient and, and put my practice at risk.
She spent 7 weeks in the pediatric intensive care unit with sepsis, a life-threatening infection, and left her permanently disabled for the remaining 19 months of her life.
Beyond the Checklist is a book that shows how the aviation safety model can be adapted to the healthcare industry.
Crew resource management was a program that gave you a process and a language, and everyone knew that everyone knew the language. So if I said to you, Captain, I'm not comfortable with this, he had to hear that because it was done in a process in a way that we were all trained. It just meant that if you spoke up, they were going to listen. And it also meant you had a responsibility to speak up.
At first, they did not buy into it. I would say the majority of my colleagues in the 1980s thought this was just another fashion trend.
They refer to it as charm school.
The old way that healthcare was organized, with the doctor up here and everybody else down here, really created terribly unsafe conditions.
They come in, they see the patient, they do possibly order entry, and then they're off the floor before the bedside nurse even knows that they've come and gone.
All of the errors and miscommunication were just catastrophic in the way they affected my daughter.
So what does it mean to go beyond the checklist?
The aviation safety movement is not one thing like a checklist. That's why we call the book Beyond the Checklist, because it's about leadership, it's about followership, it's about anticipating threats and working together to figure out what you're going to do. It's about soliciting input. It's about encouraging people to speak up and supporting them when they do speak up. It's about teamwork training and communication training, and that's what needs to be done in healthcare.
Simple fixes like using a checklist or doing a double check, those help. But if you don't change the culture, if you don't change the nature of people's work, how doctors and nurses communicate with each other, how we train young residents and medical students, then you can't really, you can make some progress, but you can't completely fix this problem.
CRM can benefit the medical industry the same way it did the airline industry, in that lives are at stake in both industries.
first of all, there's too many patients getting harmed and there's too many gaps in communication. I can't wait for the system to change.
The problem is we don't have a lot of time because patients are dying every day. And patient advocates I work with, wonder, where is the outrage? How many more people are going to die before we're going to really change the system?
Beyond the Checklist is available at Amazon or beyondthechecklist.com.